Hello friends, today I am going to reveal some true facts of autism. But first of all, I request you to please share and subscribe my channel for getting my informative true facts videos uninterrupted. Please note that subscription of my channel is free of cost. Now autism. Definition of autism. It is defined by the presence of abnormal and or impaired development that is manifest before the age of 3 years. Characterized by abnormalities of social development, communication, and restriction of behavior and interest. Autism is a developmental disorder that appears in the first 3 years of life and affects the brain's normal development of social and communication skills. Today, autism is a severe form of a broader group of disorders. These are referred to as pervasive developmental disorders later, typically appears during the first 3 years of life. Historical overview. First described by Leo Kanner in 1943 as early infantile autism. Auto children are locked within themselves. For next 30 years, considered to be an emotional disturbances. Loretta Bender first uses the term childhood schizophrenia for childhood autism. Prevalence. Prevalence is 26 to 1000 individuals, half to 1.5 million affected. 4 times more prevalent in boys. No known racial, ethnic or social boundaries. Etiology. Genetic factors. More in monozygotic twins than dizygotic twins. Siblings of autistic children shows a prevalence of autistic disorders of 2%. Biochemical factors. 1/3 of clients with autistic disorders have elevated plasma serotonin. Medical factors. Postnatal neurological infections. Fragile X chromosome syndrome. Perinatal factors. Maternal bleeding after first trimester and meconium in amniotic fluid. Parenting influence and social environmental factors. Parental rejection, family breakup, family stress, faulty communication, patterns, refrigerator parents, fixation in pre-symbiotic phase according to Mallor. Child creates a barrier between self and others. Theory of mind in autism. Mind blind, lack the ability to put themselves in the place of another person. Neuroanatomical studies. Enlargement of lateral ventricles and cerebral degeneration. Clinical features. Social interactions. Inability to make warm relationship with people. Children do not respond to their parent affectionate behavior. They smile and look at others less often and respond less to their own name. They tend to their own things regardless of who is around or what is happening in the environment. Poor use of social signals and weak integration of social, emotional and communicative behavior. Failure to make use eye-to-eye contact with people, impairment in communication, failure to develop normal speech, failure to communicate by gestures, body movements or facial expressions, lack of social uses of whatever language skills are present, delayed onset of babbling, unusual gestures, diminished responsiveness and vocal patterns that are not synchronized with the caregiver. Their gestures are less often integrated with words, deficits in joint attention, less likely to make requests or share experiences, impairment in social imitative play, difficulty with imaginative play and with developing symbols into language, lack of creativity and fantasy in thought process, may exhibit echolalia. Behavioral abnormalities, restricted, repetitive and stereotyped patterns of behavior, tendency to impose rigidity and routine on a wide range of aspects of day-to-day functioning, gets very upset by minor change in routines, difficulty in generalizing newly learned skills to new situations, stereotyped and repetitive play, ritualistic behavior like checking and touching rituals and dressing up in particular way. When the rituals are interrupted, children may become anxious or angry. Rocking, twirling, head hand banging, and similar repetitive behavior are often seen, especially in autistic children. Overactivity, disruptive behavior, and temper tantrums which may occur for little or no reason, phobias, eating and sleeping disturbances, cognitive abnormalities, poor at symbolization, understanding abstract ideas and grasping the theoretical concepts, memory may be excellent. Other features of autism. Many autistic children enjoy music particularly. Idiot 7 syndrome, in spite of pervasive impairment of functions, shortened islets of precocity or splinter functions may remain. Types of pervasive developmental disorders. Autistic disorders. Impairment of social interaction, communication and imaginative play apparent before age 3. Also include stereotyped behaviors, interests and activities. Asperger's disorders. Impairment in social interaction and presence of restricted interest and activities. No clinically significant general delay in language. Average to above average intelligence. Pervasive developmental disorder, not otherwise specified, PDD-NOS, often referred to as atypical autism, usually when the child does not meet the criteria for a specified diagnosis, but there is severe and pervasive impairment in specified behaviors. Reid's disorder, progressive disorder which to date has only occurred in girls, periods of normal development and then the loss of previously acquired skills, also loss of purposeful use of hands which is replaced by repetitive hand movements. Childhood disintegrative disorders, normal development for at least the first 2 years, then significant loss of previously acquired skills. Diagnostic criteria. 1 of 150 children are diagnosed with some form of autism. Exams and tests, routine developmental exams, language milestones, hearing evaluation, blood lead test, a screening test for autism such as the checklist for autism in toddlers, CHAT, or the autism screening questionnaire, genetic testing, complete physical examination, nervous system neurological examination, a specific screening tool, autism diagnostic interview, autism diagnostic observation schedule, ADOS, childhood autism rating scale, CARS, Gilliam autism rating scale, pervasive developmental disorder screening test, treatment of autism, behavior therapy, development of regular routine, structured classroom training, positive reinforcement to teach self-care skills, speech therapy or sign language teaching, behavioral therapies, ABA, most widely implemented evidence-based results, storyboarding, sensory integration therapy, relationship development intervention RDI, applied behavior analysis ABA, pioneered by Dr. Ever Lovak at ECOLA in the 1960. Several variations today, but general agreements that usually beneficial, sometimes very beneficial, most beneficial with young children, but older children can benefit. 20 to 40 hours per week is ideal, prompting and as necessary to achieve high level of success with gradual fading of prompts. Therapist needs proper training and supervision, regular team with meeting needed to maintain consistency. Other evidence-based therapies, speech therapy, occupational therapy, physical therapy, sensory integration, auditory integration therapy, AIT, and vocational therapy. Psychotherapy. Psychotherapy is not effective in infantile autism. Parental counseling and supportive therapy are useful in allaying parental anxiety and guilt. Pharmacotherapy. Fenfluramine helps in decreasing behavioral symptoms and helpful in increasing IQ. Other drugs are the chlorpromazine, imipramine, etc. Diet. Casein-free diet, milk cheese-free diet, wheat barley-free diet should be taken. Other approaches to talk with other parents of children with autism using secretin infusions. Outlook, fragile X syndrome, prognosis. Autism is a very challenging disability to solve because of many unknown factors. Since there is no cure for autism, proper procedures such as the therapies must be taken to help these individuals handle their problems. With proper therapy session, individuals with autism can improve their modes of communication and socialization to live very productive, independent lifestyle in society. Autistic children with IQ scores of 70 and above normally can live and work more productive, independent lifestyles within society. Autism symptoms vary from mild to severe. The prognosis for these individuals depends on the severity of their disability and the level of therapy they receive. Individuals with autism usually demonstrate some aspect of impairment of their senses throughout life. Individuals with autism are often labeled incorrectly as loners because of their inability to social interact. Approximately 33% of children with autism will eventually develop epilepsy. The highest risk with children that have severe cognitive impairment and motor deficits. Individuals with autism can live very active lifestyles. They are very capable of performing most physical activities. This will depend on the severity of the disability. Also, an active lifestyle is more likely to help the individuals with weight control, muscular endurance, muscular strength, cardiovascular endurance, self-esteem and self-confidence. Implication for physical education may need 1:1 supervision for child. Provide an initial screening process to determine a student's physical strengths and weaknesses. This will help in writing IEP objective and goals. Establish routine and smooth transition throughout the lesson. Modify equipment. Provide balls that will provide sensory output during activities that is not be balls. Video tabs can be useful for autistic children who can follow visual cues. Recommended activities. Any activity that require vigorous activities and will improve their overall fitness levels, flexibility, cardiovascular endurance, strength, muscular endurance, walking, hiking, bike riding. Type of bikes will depend on ability and balancing levels of wheels. Swimming, an excellent low impact activity that can benefit students in a variety of health related ways. Activities that require the use of their senses. Autistic children like deep pressure that helps them relax. Weighted backpacks, vest can help provide this deep pressure. Finds out the student's physical activity interests. Contraindicated activities. Having a class in a loud and a bright environment, providing too much stimuli within the environment. Activities that requires a lot of contact. Spending too much time on a single activity and not providing enough choices. Effective teaching strategies. Use teaching stations. Change activities regularly. Eliminate different distractions. Keep reactions short and age appropriate. Use sensory stimulation to increase attention span. Use smooth transitions. Instruct in an environment where noise, smells, lights will not interfere with learnings. Teach in less stimulating environment. Provide students with earplugs, cotton balls in noisy environments. Keep motivational music at low level. Establish predictable routines within lessons. Create a high structured environment which is organized and predictable. Warm-up activities closer. Use visual aids during activities. Use vigorous aerobic exercises to keep students on task. Use a consistent behavior modifications program. Provide lots of practice time repetitions. So it is when teaching. Preschool elementary considerations. Use a reward system like a sticker chart. Use a reward system is important, like a sticker chart. Teach your students basic locomotor and object control skills. Provide reward system that allows students opportunity to participate in enjoyable activity. Teach your students lead-up activities for team, individuals and cooperative activities. Have child perform tasks and draw parts of a picture that is faced every time task is completed. Use a peer tutor to assist child in learning. Allow choices when setting up the curriculum so they can choose an activity that is of interest to them. Use positive behavior management strategies. Set realistic goals and expectations. Increase the amount of activity time while decreasing instructional and transition periods. Check for basic understanding to make sure students know expectations. Provide a structured environment with appropriate routines. Challenge the students to keep them motivated. Provide a reward system for good attitudes and behavior. Provide non-verbal feedbacks and encouragement with high fives, and cheering. Be consistent and fair with your rules and consequences. Use proximity control if a problem is arising. Get to know the students and show interest towards them outside of the physical education environment. Create a positive and enthusiastic environment for everyone. Provide vigorous activities to help students remain on task. In my next video, I will reveal some true facts of other important topics. Thanks.